There has been some concern recently about unnecessary medical procedures. This may be true of breast biopsies. However, the reality of medical diagnostics is that we are never sure if a test was necessary or not until we have performed it and the results are known. On occasion, the extra test may be indicated for a timely diagnosis. We will be sharing about the diagnostic process of a breast condition here. While many doctors may feel that a biopsy for imaging findings reported as a breast cyst is medically unnecessary, stay to find out 5 features which led one patient's doctor to recommend a biopsy for her. The term breast cyst is commonly used in a radiology report. What does it mean? Is a radiologic report always accurate? In this video, we will share Kay's unique journey to her cancer diagnosis and how scientific data helped her doctor make the correct diagnosis. As shared in an earlier video segment, Kay sought a medical consult because she felt a lump in her right breast. This was the mammogram and breast ultrasound report for Kay, where the radiologist reported that the palpable abnormality in the right breast was demonstrated to be a cyst. If you were Kay, like so many women do, would you search the web or ask ChatGPT what the meaning of breast cyst was? Well, this is one website from the results of an internet search I did as I was preparing for this video. It is stated here that breast cysts don't require treatment unless a cyst is large and painful or uncomfortable. Kay's lump was not painful or uncomfortable, and on this page, there is no definition on what constitutes large. Assuming, therefore, that this was a cyst, should Kay have the fluid drained from her breast cyst? By referring to Kay's abnormality as a cyst, the radiologist appeared to be making a definitive diagnosis without pathologic examination. In my practice, I prefer not to do that. After physical examination and review of the images, I would discuss with my patient the likelihood that she has malignancy based on prior research studies which have been published on similar clinical situations. So how should a careful review of the radiology findings be done to assess the likelihood a patient would have cancer? Let's look at 5 characteristics in Kay's clinical situation. But before that, I'll comment on the ultrasound image of Kay's finding, which had a few features that could be mistaken as those consistent with a cyst. The lesion is very dark, or what doctors would refer to as strongly hypoechoic or anechoic. There was also a hint of a lighter area immediately below the lesion, what doctors would term posterior acoustic enhancement. However, there were also features that did not completely fit into the characteristics expected of cysts. First, the lesion appeared to be taller than wide. Strictly, probably benign lesions should be wider than tall. The second characteristic was that the edge of the lesion was not completely smooth. Thirdly, there appeared to be a lighter, or what medically is called a hyperechoic, halo. The next characteristic not completely consistent with a probably benign lesion was that the lesion disrupted the natural planes of the breast tissue. Here we see that the natural planes of the breast were horizontal, but the orientation of the lesion was vertical and abruptly cut off the flow of the horizontal lines. The 5th point to consider in Kay's clinical situation was the fact that her abnormality could be felt. It was palpable. We recall that while this website mentioned treatment may be required for a cyst that is large, there was no guidance on what is defined as large. In Kay's case, her lump was recorded to be 1.2 centimeters at its largest dimension. Was this considered large? Regardless, there are published studies about such clinical situations. Here is one of them. This team of doctors found that 4.4% of women who had clinical findings like Kay would have breast cancer. This risk profile would place Kay's clinical condition higher than 2%. In general, monitoring is recommended for findings that carry a less than 2% likelihood of malignancy, but this was not the case for Kay. As Kay mentioned, a needle biopsy was recommended for her. Cytologic examination showed carcinoma cells present, consistent with ductal carcinoma. Therefore, a diagnosis of breast cancer was made. It would be difficult to say that biopsy or treatment is not required for all cysts. Careful evaluation of each lesion is advised. She underwent breast-conserving surgery uneventfully, and final pathology was reported as invasive duct carcinoma, 15 millimeters in size. I'm happy to report that Kay's treatment and recovery proceeded uneventfully. If this information has been useful, please like, share, comment, and subscribe. Also, share with us in the comment section what information you would like so that we can plan our next video with your needs in mind. Until we come together again, take care.